looking at the growing mental health crisis and the impact on the Erie County Medical Center. Hospital administrators tell News 4 Investigates they've been working hard over the past year to make the patient experience better and more efficient.
The hospital even has big plans to modernize the physical layout, but it's not happening. Why is that? Luke Moretti reports.
As the region's only safety net hospital with a comprehensive psychiatric emergency program known as CPEP, Erie County Medical Center receives patients with complex and at times critical mental health issues. The hospital does it 24/7, never turning anyone away.
We don't want you to have to go to CPEP if you don't need to go to CPEP.
Erie County Department of Mental Health Commissioner Mark O'Brien says alternative mental health resources are in place with other options coming online. The hope is to mitigate the burden on ECMC Psychiatric Emergency Room, which sees patients coming voluntarily and others via legal mechanisms guided by state law. In other words, individuals deemed a danger to themselves or others, whether it be an adult or adolescent.
People look at CPEP as the comprehensive psychiatric emergency program, meaning it should be all things to all people. And that's not what it's designed for, and that's not what it's capable of.
O'Brien is well aware of staffing and wait time issues raised by some patients and their families over the years. He tells News 4 Investigates some of the complaints raised are out of the hospital's control. At times, patient surges in CPEP can place a strain on staff and the number of inpatient beds. Commissioner O'Brien says Erie County and the State Office of Mental Health have been monitoring the situation at CPEP, even conducting unannounced visits over the past year.
The teams came in and largely did not find that. They didn't find anything that would call for their license to be pulled or anything egregious, and they made multiple visits.
Last year, a News 4 Investigates analysis examined wait time data from 2019. We discovered that 30% of ECMC CPEP patients that year waited longer than a day for a doctor to assess and determine if they would be discharged. That was the second worst rate of the 22 CPEPs in the state. But that was then. Hospital administrators say they're constantly working on how to better deal with surges and wait times, and that progress has been made.
The initial entrance to CPEP triage, you're going to see a psychiatrist.
You are seeing a doctor.
Right away?
Yes.
Okay.
Because that is the only way we make a decision to move you into the actual care.
And then it's possible they don't see the doctor, not necessarily that same doctor, but another psychiatrist for maybe a day or two. Is that possible?
The goal is within 24 hours,
okay,
all the time. And most times we do connect with that.
County Mental Health Commissioner Mark O'Brien acknowledges that the hospital has made a lot of improvements to CPEP in the past year. But he says one thing that struck him was the way the layout is configured.
Would I have designed it like that? Probably not. So they have to look at their physical plan. I don't know if there's any plans to do that right now, to say they're going to be able to redesign that, but I know they're looking at with everything they can do in terms of to make it more user-friendly.
Actually, ECMC has a modernization plan for CPEP and even applied for state grant funding. Among the proposed modifications, renovating the adolescent treatment area into a new group activity area, enhancing comfort and quiet rooms to help with de-escalation, expanding the existing nursing station to integrate social workers into the treatment area, connecting the public waiting area with the existing patient advocate office space to make communication easier with family and friends of patients. But the funding request was not selected for an award.
It was a surprise to not get it. It really was looking at renovating the space in a way that was patient-friendly, but also enhance what we could do with our doctors and professionals.
The total cost of ECMC's emergency care modernization plan was around $13 million, which includes the CPEP component, estimated to cost around $1.6 million. Without the state grant funding for capital improvements, the project is on hold.
I was very surprised that it was denied. I was for sure that we were going to be making the renovations that we had planned on making. We were doing walkthroughs and how we can make better changes for our patients and for the care area.
The growing need for mental health treatment is very real. And while more resources are coming online, is there a need for another CPEP in this region? Another full-service 24/7 psychiatric emergency room? We'll explore that in our next report. Luke Moretti, News 4.